let's talk about neurotransmitters. And specifically, I want to talk about how neurotransmitters regularly function in your body, as well as what role they play in the pathophysiology of different mental illnesses. Understanding this will also help us sort of get a fundamental understanding of what role these neurotransmitters can play in pharmacology of psychotropic medication. So the neurotransmitters we're going to focus on are serotonin, dopamine, norepinephrine, GABA, acetylcholine, glutamate, and even though histamine doesn't really have a role in how mental disorders happen, you'll see it a lot in certain psychotropic medication. So as review on how neurotransmitters work, here's your presynaptic neuron and your postsynaptic neuron. Neurotransmitters are carried in vesicles within the neurons, and then they bind the neuron wall and are then released into the synapse where they bind onto receptors from the postsynaptic neuron, and then they push along their effect through that postsynaptic neuron. Three neurotransmitters I want to focus on as monoamines are serotonin, dopamine, and epinephrine. Now specifically, these neurotransmitters can be taken up through reuptake channels when they're no longer being used, which helps decrease their effect in the synapse. And also, monoamine oxidase can come and metabolize these neurotransmitters either in the synapse or the presynaptic neuron in order to, again, kind of modulate the effect of these neurotransmitters. They're called monoamines because their precursors are amino acids from protein. Serotonin is from tryptophan, whereas dopamine and epinephrine come from tyrosine. Now we recognize tryptophan as the amino acid that we attribute to turkey. So on Turkey Day, when we eat a whole bunch of turkey, it becomes tryptophan and makes us sleepy. And tryptophan is converted into 5-hydroxytryptamine, which is then the precursor to serotonin. It's important to remember 5-hydroxytryptamine because we use the abbreviation 5-HT almost synonymously with serotonin. So if you see 5-HT, just attribute it to serotonin. So there's a couple problems with that turkey tryptophan theory. One of the problems is tryptophan does not become serotonin until it crosses the blood-brain barrier, which it cannot do unless it uses the active transport. But another problem is the brain is sort of like the most exclusive club of the body, and there's a huge guest list, which tryptophan is not a part of. So it has to go in the back of the line where less polar, larger molecules are able to get across. So let's talk about a scenario. Let's say here we are, and this is Thanksgiving. And let's say right here, here's our cousin Eddie. Now Eddie, he wants to be a bodybuilder, and he knows that most bodybuilders usually just eat a diet of meat. So he's just going to eat turkey. Now so here's eating turkey, and turkey becomes tryptophan. However, one of the problems with this theory is that meat-based proteins, like turkey, all tend to have the same amount of tryptophan. Turkey, ham, they all have the same amount of tryptophan, and really, compared to plant-based proteins, there isn't a huge tryptophan to protein ratio. And the other problem is it can't cross that blood-brain barrier because of the exclusive list. So let's say some of it does get across, not very much. It's turned into serotonin. About 90% of that will go into the GI system. Serotonin helps keep your intestines motility. So him having not enough serotonin might cause some constipation. Not enough serotonin in his brain might cause some irritability, some agitation, some obsessions, some depression. Serotonin is converted into melatonin. So if that's not happening, you might have some sleep irregularities. So here we are. Now cousin Eddie, he ate all of the turkey, but we also want to eat healthy. So instead of going straight to all the mashed potatoes, we're going to eat some pumpkin seeds. Now pumpkin seeds are a plant-based protein, which means they have a high tryptophan to protein ratio. So when we eat them, it converts to more tryptophan than a turkey did, and even though the blood-brain barrier is there, it does something else. It produces glucose, which causes insulin to be released in the body, which then helps recruit some of these other amino acids to go be absorbed into the muscle and to help the metabolism of glucose, which gives tryptophan direct access into the brain where it can become serotonin. Okay? So now we're happy. Maybe if we had a lot of it, our body's converting some serotonin to melatonin at 4 p.m. is going to cause some drowsiness too. So to help remember what serotonin does, we think of it as deficiency. When there's not enough serotonin, it's causing depression. Okay. Also can cause obsessions. And the way this is understood is you're driving to work and you don't remember if you left the stove on, so you turn around, you go back, and you look at your stove. If the stove is off, your body gives you some serotonin to help satisfy that thought. If you don't have enough serotonin, you won't satisfy that thought, and you'll go back to work and have to come back, look at the stove, go back to work, go back, look at the stove, which is really the basis of like obsession, compulsive disorder. Lack of serotonin is also attributed to migraines, anxiety, intestinal issues. Like I said, serotonin causes GI motility, so too much serotonin can cause GI upset, diarrhea, and nausea, and not enough can cause constipation, and N is for nausea. Also, too much serotonin can decrease libido and sexual performance. And as we said before, serotonin can turns into melatonin. So not enough serotonin can cause decreased sleep, but actually increased serotonin has also ties to insomnia. Now we can remember this by remembering that serotonin acts on many domains. All right, let's talk about dopamine. Dopamine is a neurotransmitter for memory, attention, and energy. The ventral tegmental area, or the rewards pathway in your brain, which is tied directly to the limbic area, which we associate with memory, helps us learn what activities we like and what activities are good and we want to continue. Like exercise causes dopamine release in this area, which tells us to exercise. Spending time with family release dopamine, which helps us remember that we like doing that. But this is also attributed to substance abuse, gambling, and screen time. Other pathways important with the dopamine system are the mesolimbic pathway, which we attribute to the positive symptoms of schizophrenia. We believe excess dopamine causes positive symptoms like hallucinations, delusions, and disorganizations. The mesocortical pathway is where we attribute the negative symptoms of dementia with decreased dopamine, where we see apathy, flat affect, poverty of thought and speech, catatonia. And really, these are really the two big components of schizophrenia, so showing that schizophrenia is probably a disorder of poorly regulated dopamine. The tuberoinfundibular pathway is important to know when we're treating schizophrenia, as when we usually treat schizophrenia by blocking dopamine. Dopamine has a huge role here where it is modulating prolactin. So when we decrease dopamine, we will increase prolactin, causing gynecomastia, which is breast development in men, amenorrhea, and milk discharge. Nigrostriatal pathways is also attributed to side effects of antipsychotics, which cause the extrapyramidal symptoms, or the involuntary muscle movement cortex, where we see some dyskinesia, Parkinsonism, and akathisia. And this is also why we believe dopamine deficiency is what causes Parkinson's. So dopamine peripherally increases your heart rate, increases blood flow to your kidneys, which then increases urinary excretion, slows down your gut motility, and some of the chemoreceptors in your brain, when you decrease dopamine, can help with nausea. You'll see some of the anti-nausea medications are actually dopamine antagonists. So let's move to norepinephrine. It's your fight and flight neurotransmitter. Okay? So when you come across a bear, and your body releases norepinephrine peripherally and centrally, you become hyper-focused, you increase in energy, your heart rate increases rapidly, the bronchioles in your lungs expand, which allow you to oxygenate your body and your limbs to fight or flight. You begin to sweat, and your body no longer worries about things like eating and going to the bathroom. Acetylcholine, which is the counter-neurotransmitter to norepinephrine, acts on two different receptors, muscarinic and nicotinic. Neurotransmitter has acetylcholinesterase, which, like the monoamines, helps metabolize the acetylcholine to regulate its therapeutic effect in the synapse, which is important to remember for different medications. Now, focusing on the muscarinic receptors, it helps our body rest and digest, which is the opposite of the fight or flight. This is the parasympathetic nervous system that this enacts. Okay, or feed and breed. So this helps calm us down, slows our heart rate down, decreases our focus, makes us interested in eating and digesting, and then going to the bathroom. Acetylcholine is also responsible for sexual attraction. Too much acetylcholine that might happen with different pharmacological agents causes a cholinergic crisis, where you see hypersalivation, lacrimation, urination, diaphoresis, gastrointestinal effects like cramping, emesis, and meiosis, which is the constriction of your pupils. Which you can help remember this by thinking of Sludgem. Now, the nicotinic receptors of acetylcholine are responsible for skeletal muscle contraction. It also is contributed to learning, memory, and focus. I know it's kind of weird to think of skeletal muscle contraction as a part of the nicotinic receptors and not the muscarinic, but to help you, just think of all of these people smoking. The next neurotransmitters we're going to talk about are the glutamate and GABA. So here's a glutamate neuron and a GABA neuron. Glutamate binds to AMPA and NMDA receptors. Binding to these receptors, the receptors open and allow for sodium and calcium to be pumped into the postsynaptic neuron. This causes depolarization and excitation, which elongates the electrical impulse that goes through the series of neurons. An example of this happening is with seizures. As seizures happen, glutamate is the neurotransmitter that promotes those impulses, which is why a lot of anti-seizure medication block the action of glutamate. On the other side, GABA, when released, binds to GABA receptors, which cause the influx of chloride. As negative charged, it hyperpolarizes the neuron, which causes inhibition, which is why a lot of anti-seizure medications promote GABA release. Also, interestingly, a lot of anti-anxiety medications like benzodiazepines and barbiturates also promote GABA. GABA has reuptake channels and also GABA transaminase, which metabolizes, which helps regulate GABA, which other medications to promote GABA can inhibit this process here and cause GABA T not to work, which causes more GABA to be available for the receptors. Now, GABA, like I said, can be found in anti-anxiety medications as it's the biggest inhibitory neurotransmitter. It can cause calmness, lack of anxiety, sleeping, and on the other side is memory loss. Glutamate isn't exactly the opposite of GABA, whereas it is associated with memory and learning, though because anti-seizure medications cause glutamate to be disabled or GABA to be promoted, help show that maybe glutamate is associated in some way to mania, as anti-seizure medication is used to treat mania. The last neurotransmitter I want to talk about is histamines. Histamines, we know, we take antihistamines to help with our allergies and also stomach acid as far as H1 versus H2 receptors. But in psychotropic medications, we think of histamine as being activating. So antihistamines help treat insomnia or cause drowsiness. Also, antihistamines will cause appetite increase, as histamine itself is appetite suppressing. So that's the end of our presentation.
Thank you for listening. I have listed all of the neurotransmitters that we talked to, and I hope to get into more detail in further presentations. Thank you.